Hello everyone, welcome to Ailsoft EdTech. My name is Dr. Ezeadichie Emmanuel Chinedu, and I'll be your instructor for today's video, titled Major Anatomical Planes. Now, this video is a continuation of my previous video when I talked about what is body planes and why it is important to know body planes. Now, for today's video, we'll be talking about the different types of body planes. But then you also need to understand once again that a body plane is that imaginary line that divides the body, as you can see here. This is an imaginary line. It divides the body into what? Different sections. Okay? Different sections. And we have four types of these body planes. We have the median plane, we have the sagittal plane, we have the dorsal plane, and we have the last but not the least, which is the transverse plane. And these planes are all what? Divided by imaginary what? Lines. Now, the median plane is an imaginary plane that passes through the center of the body. Now, it passes through the center of the body from the head to the tail, dividing it into two equal halves. So when you hear the word two equal halves, it means whatever you have on the left is what you have on the right. You have one eye on the left, you have one eye on the right. Your nostrils are divided. Since they are divided at the center, the midline. So you have one of the nose at one part, the left, and the other one at the right. The limbs, the forelimbs and the hind limbs. You have one each at both the forelimb and the hind limb. So that imaginary line that divides the body into two equal halves is called the median plane. And you also need to understand that aside the median plane helps us to understand the meaning of the word lateral and medial. The median is not the same thing as medial. You need to be very careful with your spellings in veterinary medicine. Median is the imaginary line that divides the body into two equal halves, but medial is another word entirely. Now, any structure that is closer to the median plane is is medially located. So structures closer to the plane are called medial structures. Or just say that they are medially located. But any structure that moves farther away from the plane is laterally located. So you see this ear now on this left part of this animal, this ear now is laterally located. Why? Because it's far away from from the median plane. Now, this eye is medially located than than this ear, because this eye is closer to to the median plane. So anything that is close to the median plane is medially located. And anything far away from the median plane is laterally located. So this is the medial that we are talking about here. Okay? This is the medial. You see it? Let me underline it so that you will see. Okay? This here. This is the medial. MDIAL. Medially located. So any structure closer to the midplane are medially located, while any structure far away from the midplane are laterally located. So aside having four different types of body planes, under median plane, we have the medial and the lateral. These are sub-definitions that you need to hold very close, because it will help you in identifying lesions. Let's proceed. So the next is what? Now look at this image. Can you see this image? Now you see this imaginary line here is what? Is the median plane, because it divided this dog into two equal what? Half. The right half and what? The left half. Now, lateral is what? The structure is what? Far away from the what? The median plane. While when the structure is, closer to the median plane is what? Medial. Any structure that is closer to the median plane is what? Medial. Now you see, medial structures closer to the plane. Let's see. Okay. Vertebral column, spinal cord. You see, the spinal cord now is located at the midline region. Okay. Now, let's see, let me use a better example. See, examples of anatomical structures. The medial structures closer to the plane. The trachea, yes. The esophagus, because it's what? Closer to the median plane, the middle. Lateral structures include what? The shoulder. You see, this is the shoulder region. Now you see this is far away from the what? The median plane. So this structure, the shoulder, is what? Is laterally located. The lungs, the two lungs, the left lungs and the right lungs, okay? They are what? Far away from the median plane. So they are what? Laterally located. The two kidneys, they are far away, okay? But when you talk about the trachea, it's close to the median plane. At this region here, is very close to the median plane. So these are what? Medial structures. From this image, you'll see it. So you see, from this arrow now, you see, when the structure is moving towards the what? The median plane is called what? Medial. But when it's moving away from the median plane, it's called what? Lateral. So it's laterally located if it's moving away from the middle of the what? The animal. But if it's moving towards the middle, it is medially located. Okay? Then over to the next, we have the sagittal plane. Now, why the sagittal plane, understanding this plane is very important is because it's almost the same thing as the median plane, but it's not the same. A sagittal plane runs parallel to the median plane. So let's say the median plane is running at the middle of the what? Of the body, dividing the body into two equal halves. Let's say now, let me draw a line here, okay? Now let's say, you see this line I'm drawing now? This line is what? Is a sagittal line. Is sagittal line because it runs parallel to the median what? Plane. The median plane is the middle of the what? The body. An imaginary line dividing the body into two equal halves. But the sagittal plane is an imaginary line dividing the body into two unequal halves. So you see, this side from here to here is not the same as from here to what? To here. Unequal what? Halves. So the sagittal plane, unlike the median plane, it divides the body into two what? Unequal right and left sections. There can be many sagittal planes. Yes, many. There can be many. Any line that divides, it can be here, this line, it can be here, it can be here, but there can only be one median plane. But if it's a sagittal plane, there can be what? Many, as many as possible. So you see why it's important to what? To understand your body planes. Because veterinarians commonly use this plane during imaging, interpretation, and what? Anatomical studies. And for anatomical communications. Because you can't be communicating with your fellow what? Veterinarian, and you're using the wrong terms. Now let me go back and give you some key examples. Now look at now. Medial structures closer to the sagittal plane. Now you see this nose now. You see this nose. Because it's closer to the sagittal plane, that line I drew, let me draw it again. Okay? Let me draw the line again one more time. Now you see this nose now is medially located because it's closer to the what? To the what? The sagittal plane. So you can also use medially located for what? Sagittal plane. It's not only restricted to what? To the median plane. So understand, median plane is the imaginary line that divides the body into two equal halves, while sagittal plane divides the body into two unequal halves. Then we have the dorsal plane. The dorsal plane divides the body into what? The dorsal portion, which is towards the back. The dorsal portion, which is going towards the back. And the ventral portion, which is going what? Towards the abdomen. So anything going towards the back is dorsal, while if it's going towards the stomach, is ventral, ventrally located. The udder is ventrally located. The penis of this dog is ventrally located. The back, this animal's back is not even the back, the spinal cord, the vertebral column is dorsally located. In a standing dog, the vertebral column lies dorsally, while the abdomen, the stomach, the abdomen lies ventrally because it's going towards the what? The abdomen. Now, this plane is very important in radiography and surgical positioning because if you don't understand the dorsal plane, you will not be able to position your animal in the proper way to perform a what? A surgery. So any structure that is closer to the dorsal plane are termed medial. It's still the same thing. So if there's a structure closer to this dorsal plane, is what? A medial. The structure is medially located. Now, as you see this one here now, so let's say for instance now, let's say, which structure will I use now? Let's say one of the kidneys is around this place now. That kidney is medially located to this dorsal plane. So medial is what? Anything going towards the plane. Why? If it's going far away from the plane, it is what? Lateral. But then dorsal plane is when it's moving towards the back, and ventral and the dorsal plane, sorry, it divides the body into two portions. The dorsal portion when it's moving towards the back, the ventral portion when it's moving what? Towards the abdomen. Okay? And the last but not the least, which is the what? The transverse plane. Now, why I love the transverse plane so much is that even in humans too, the transverse plane is important. Now, a transverse plane cuts across the long axis of the body. It divides the body to the what? Into the cranial portion and the what? The caudal portion. So you see, this line, this plane now, this imaginary line that divides this animal into two, okay? We have this portion, we have this portion, and we have this portion, okay? So this imaginary line now that divides this animal into two portions, into two parts, giving us this cranial part and giving us this what? This caudal part. Now, when they say cranial, anything that's going towards the head region. This is the head. This top here is called the cranium. Okay, so anything going towards this cranial region, towards this cranium, is called what? Cranially located. So if it's moving towards this region, it's cranially located. While the tail anatomically is called what? Caudal. So anything that is moving towards the tail is what? Caudally what? Located. Anything moving towards the tail. And the transverse plane divides the body into what? Two parts, two portions. The cranial part and the what? the caudal part. So towards the head is the caudal part. So structures closer to the what? To the transverse plane are termed medial. Is still the same thing. So if there's any structure closer to this plane around this region here, is medially located. But if it's far away around this region here, this neck region here, is laterally located. So you need to understand that all these things, a proper understanding of them all will make you a professional and one of the best in your field. So these, okay, let's see. Now, key points. The transverse plane runs horizontal at right angles perpendicular to the long axis of the body and divides the body into the cranial towards the head and caudal towards the tail part. It's the same thing. Now, I know when we talked about the median plane, we introduced medial and lateral. Now we are talking about the transverse plane. I'm about to now introduce what? Two key words. Proximal and distal. Because the transverse plane does not only, because it says the transverse plane divides what? Into two parts, cranial part and the caudal part. And also, the transverse plane runs horizontally at right angles to the long axis of the body. So this transverse plane is running horizontally, you understand, at right angles to the what? At right angles to the long axis of the body. This is the long axis of the body. And this line has divided it, forming a what? A perpendicular what? Line. Now, this is a transverse plane. This is a transverse plane. This is a transverse plane. And understanding that this is a transverse plane will give you a better understanding of the word proximal. Now, proximal means nearer the body. So anything that is close to the body is what? Proximally located. And if it's going far away from the body, it is what? Distally what? Located. So you see, this palmar region of this forelimb is what? Is distally located, while this elbow of this dog is what? Proximally located, because it's what? It's nearer to the body. That's why it's proximally located. The same thing here. This plantar surface is what? Is distally located because it's what? Is farther away from the body. Is moving away from the body. While this hip region, okay, is what? Is proximally located because it's nearer to the body. So your key understanding of all this is very important, because with it, you can conquer any veterinary world. This is what I'm explaining here. You see it? So let me erase this. Okay. So as you can see, this is a transverse plane. You see? This is it here, a transverse plane. How it divides the forelimb. A transverse plane cuts across the limb at point the body and distal, which is farther from the body. Example, plane cutting through the what? The antebrachium, which is the forearm. You know, this is the brachium. You understand? This is the, yes, this is the brachium. Okay? Yes, this is the brachium. Okay? While this is the antebrachium. The brachium and the what? The antebrachium. So the transverse plane, as you can see, is a plane that cutting through what? The antebrachium. So the proximal part closer to the body includes the what? The elbow. You see this region, the elbow, is the proximal part. While the distal part, further from the body, includes the what? The portion of the limb below the cut. So this whole thing here is what? The distal what? Part. In the forelimb, the transverse plane divides the limb into proximal, closer points of attachment to the body, and distal, farther from the point of attachment. Now, this is the what? This region here is the closer point of attachment to the body. Also, this region here. So, the closer point of attachment, you understand, is the proximal aspect, because the proximally is what is a closer to the point of attachment of the body. So any part that is closer to the point of attachment of the body is proximally located. While if it is far away from the point of attachment, which is this region, is far away from the point of attachment, is distally located. And the clinical importance, once again, body planes are not simple theoretical ideas. A veterinarian may say, there is swelling on the lateral aspect of the distal forelimb. And breaking this down, you first of all check the lateral. When it says lateral, away from the midline. When it says distal, farther from the what? From the body. And when it says forelimb, is the front limb. So with our knowledge of what our veterinary body planes, so let's go and check. There is a swelling on the lateral aspect of the distal forelimb. Mhm. Now let's use this animal for instance. There's a swelling at the lateral aspect of the distal forelimb. Now, lateral aspect means what? Far away from the midline, okay, from the median plane. So this is the lateral aspect. There's a swelling on the lateral aspect of the distal part of the forelimb. Now, this is the distal part because it's far away from the point of attachment. So this is the distal part of the forelimb, and this is the forelimb. So we'll be looking for our swelling around this region, around this region. And when we see our swelling, we immediately what? Open up or treat. So you see why it is very important to understand what body planes are, how to use them, and how to interact with other veterinarians about what body planes, so that you can identify lesions in the animal's body. Thank you once again for tuning into today's video. And on our next video, we're going to be talking about directional terms, which are very, very important, and you don't want to miss that. Okay? So see you on our next video, and good to have you here once again. Remember, this is Hillsoft EdTech, and I am the instructor for today's video. My name once again is Dr. Ezeadichie Emmanuel Chinedu. Goodbye.